Good afternoon, it's Dr. Larson to talk about COVID-19 in Kittitas County. We now have what we were hoping to avoid in Kittitas County, which is an outbreak of COVID-19 in a long-term care facility. As you probably knew from watching our press releases, it's at Prestige Acute Care and Rehab Center. We currently have 4 residents and 5 staff that are positive in that facility. That facility was tested by the state in early June. All residents and all staff, they all were negative. Since that time, as you know, we moved from phase 2 into phase 3, and the result of that is that there's a lot more people out and about doing things, and which is logical. We've said that you can get together with groups of people less than 50. A lot more businesses are open. People are out having birthday parties and those type of things. But just because we can do something doesn't mean we should do something. So the resultant outbreak at both at Meadows Place, which fortunately we tested last week, we only have 2 staff positive at that facility, no residents positive, and we tested all of Prestige Acute Care and Rehab today. We should have those results later this week. But all of those positives are because we're out and about doing more. And that's a concern to me. It's a concern to me that people aren't wearing masks, that people have forgotten that the virus is out there, and we've moved into an area where people have said, okay, well, it's more normal, so we're going to start doing more normal things. So I'm asking you, even though we can have groups of people less than 50, I'm asking you not to do that. I'm not moving businesses back into phase 2, but I am asking that unless it's something that you really have to do as far as getting together, please don't get together. We would expect, now that we have a disease in the nursing home, that's a bad place to get COVID-19, and we would expect to have some deaths from this situation. So please stay at home, please wear a mask, stay in your bubble with those people in your family, and maintain social distance. So I'm gonna go with some questions today, and then I'll wrap it up with something else. So there's a question about K through 12 students wearing masks in the fall. Why aren't preschools required to wear masks, students and teachers? There's a lot of inconsistency in regards to recommendations. Recommendations for K through 12 schools are made in conjunction with teachers unions, made in conjunction with the State Board of Health, made in conjunction with leaders in those fields, and the recommendations for all students K through 12 to wear masks is coming from OSPI. If you were in Idaho, they may have a different approach. Preschools and daycares are not managed by OSPI, so that's why there's a little bit different there. But it is a little hard to understand inconsistencies like it was at the beginning when we allowed commercial construction to happen and not residential construction to happen. So we do know that masks work. We know it's one of the few tools that we have that really can reduce the burden of this disease. That's the reason the governor's mandate for wearing masks for everyone older than 2. That does apply to preschools and daycares as far as businesses go. So there is some leeway that's given to that situation, and again, there's some carve-outs for certain folks that have a reason that they can't wear a mask. But most of us can wear a mask, and please wear a mask. Next question has to do with the amount of time we're with somebody and how much exposure and how sick a person is and how likelihood that we are to get sick. So that's probably the reason that we are going to be able to have at least kindergarten through 5th grade. So younger kids have lower burden of disease. They have lower viral loads. They transmit disease less. So as far as schools being open, it's more likely that we would be able to do that well in that K through 5 age range. The more viral load somebody has, the shorter period of time that you have to be around them to be exposed and have that person be contagious. So the more viral load somebody has, it doesn't have to be 15 minutes, it could be 5 minutes, which is really why if you can stay in your bubble at home, it's better. But we have to have some criteria. So the criteria for close contact is closer than 6 feet for more than 15 minutes. The 6 feet is also not a magical thing. If somebody's coughing a lot, their droplets can go up to 15 feet, but we're using 6 feet as a cutoff. The American Academy of Pediatrics said we could use 3 feet in schools, so we're still working on that. The goal is really to get schools going in the fall safely, and so a lot of work is going in with that. Numerous businesses in town are not enforcing the masking policy. Is something being done about that? So the sheriff's office said they were not going to enforce that, even though it's against the law. They have other laws that they feel like they need to prioritize other laws. But you as a individual can file a labor and industry claim. Labor and industry has been to our county. People have been fined for doing that, for not following masking policy. And you can also walk with your feet. So if you go into a facility and they're not wearing masks, don't go back to that facility, go somewhere else. The next is a question about long-term care facilities. We did test all the people at those facilities today. We would expect those results to be back later this week. We did get those sent up to Northwest Labs in Bellingham, which is contracted with the state. They went up by FedEx today, and we would expect those back hopefully by Thursday or Friday of this week. We are considering trying to move forward with our annual youth service camp, but would only do it safely and wisely. Currently, in phase 3, we can have groups of less than 50. So if you have an event that has less than 50 people, staff, children, those type of things, then you legally can do that event. Then it's doing things, wearing masks, maintaining social distancing and those kind of things. But the 50 people is a hard 50, it's a hard stop. So if you can do it with less than 50 people, then it's still currently allowed under phase 3. Another question, a couple of questions. One is about aerosolized COVID-19. So there is a lot of data that COVID-19 is aerosolized, so it can hang out in the air for a long period of time, can go through heating and air conditioning systems and those type of things. There's been some recent news around that. What we don't know yet is whether those particles are actually infectious. So more science to come. This particular question talks a little bit about classes outside. Classes outside would be safer than classes inside. Buildings with good ventilation are better than buildings with less good ventilation. Using HEPA filters is helpful, and more science on that to come. It would be really concerning to me if we determine that we have more aerosolized transmission than what we think there is currently. That would make things a lot harder moving forward. But we know that the measures we have in place are going to be here for a long time. So masking, that's going to be here throughout the school year. Social distancing is going to be here throughout the school year. And it certainly will be here until we get a vaccine and until enough people are willing to get the vaccine that we have herd immunity. So I would expect those measures that we know work, masking and social distancing, to be in place at least through next summer. A question about a teacher getting quarantined. So if somebody gets COVID-19, that person is in isolation for a period of time, 10 days plus 3 days of not having symptoms. we do a contact investigation with that person and determine who's close to them. A teacher being positive doesn't mean their whole class is going to be within that 6 foot, 15-minute bubble, but some of those kids will be put in quarantine, the close contacts. A question about what number we would have if we close schools, and that's the same question President Guadino asked me about. What number do we have to close Central Washington University? It's not really a number. It's how many people are sick in what particular environment, and how can we mitigate that? How can we make a change? So for example, we had a graduation party. We've had over 20 students that were positive, and what we're going to really try to do is have people not have those events. If we had a group of kids in a science class, for example, that were positive, we might say, okay, well, how can we reevaluate and re-engineer this science class so we don't have so many people close together and we can reduce that? So it's not really a true number. It'd be nice if it was, because then it'd be like, okay, well, we have 116 patients in a classroom, we're going to close a school. It's not going to be that simple. It's going to be working a lot with the teacher in that class, working a lot with the principal, working with their leadership in that particular school to come up with a solution to the problem. So the schools are making plans as to what to do when they have cases. We know they're going to have cases. Ever since we went into phase 3, currently, if we applied to move into phase 3 now, we would not meet criteria to move into phase 3. We are not qualified to move into phase 3, and that is really because people took moving into phase 3 as a pass to be less concerned about COVID-19. So we're hoping that people become a little more serious about COVID-19. We're hoping that with COVID-19 in 2 long-term care facilities in the county, that people will see how dangerous it is, and we can continue to move forward at opening businesses that are doing it safely, that we can move forward with the economy, and we can move forward with school. But that requires all of you to be doing your part, to be wearing a mask, maintaining social distancing, and not going to large gatherings. So large gatherings, again, are a problem. I'm concerned about what I saw at Cary Lakes over the weekend, the number of people that were there. I'm concerned what I saw up at Salmon Lasac, the number of people that were there that were not social distancing. And we had a 21-year-old die last weekend, not here, but at Penn State. So a college student. So serious disease does happen in college students, as well as if we have more disease that it's occurring in college students, it's quite possible that athletics this fall won't happen, either at the high school level or at the college level. So the determination of that really doesn't depend upon us at the health department. It depends upon you as individuals. So that's the end of the questions today. I'm just going to, again, reiterate that we're in a really dangerous time currently. The nursing home is concerned. Our long-term care facilities are concerned. The hospital is concerned, because we know that those are the people that get sick and move on to the hospital. So please do your part, wear a mask, stay at home when and please do not go to large gatherings. Take care, and I'm actually going to have another one of these on Wednesday of this week, because I know we're going to have a lot more in regards to our long-term care facility outbreak. Thanks a lot, and take care.